Hello, I'm Bob Schrupp, physical therapist.
I'm Brad Heineck, physical therapist. Don't bother me, Bob. I'm looking up the Epley's maneuver we're talking about.
Right, today we're going to talk about the Epley maneuver. Basically we're going to show you how to do it. It's also called the canalith repositioning maneuver. And what it's for is a type of dizziness, and specifically we usually use it for benign paroxysmal positional vertigo.
It's a mouthful.
It's a mouthful, it's a type of vertigo, a type of dizziness, and basically what we'd like to see is that you were diagnosed with this by your doctor, and now you were asked to do this type of maneuver, or your physical therapist or somebody may be doing this maneuver with you, and we're just going to go over it with you, or maybe a professional who has to do this. It's a good way, a review of that. So let's go to it.
All right. Okay, after I interview a patient and I find out what's going on and I have it confirmed that it is vertigo, yeah, that they got vertigo symptoms, and I just skip the big words and go right to it so it makes sense to the patient and it's easy to communicate with. I find out which way produces the symptoms, and when I say which way, which direction, and oftentimes I say when I lean or turn my head to the right, or when I'm in bed and I roll to the right, and sometimes it's to the left, but in this case, when Bob turns his head to the right or when he rolls to the right in bed, things start spinning. Is that right, Bob?
That's correct.
Very uncomfortable,
Very
makes you feel
uncomfortable.
very nauseous,
Yep.
and that can be at different intensities as well. So once I determine which direction, that tells me which way to start the treatment. And what I mean by that is which way to turn the head. So what I have someone do is get up on the table, sit like Bob is sitting, and we get their back at approximately a 45-degree angle. You don't have to get the goniometer out measured, but just sort of about like what Bob is now. And then he's going to turn his head to the right and tilt back.
I don't think we tilt back until we go back.
I tilt back a little bit, Bob.
Okay.
Different therapists do this a little differently, but
Turn
he turns
your
his
foot
head-
back,
he-
tilt
Bob,
back.
and Bob doesn't like to tilt back yet. I'll do a little bit, depending on the patient's response. Okay? So once we get to that point, we hold it for 30 seconds to a minute. And in this case, we're going to go for 30 seconds just to shorten it up. Okay, Bob, we just finished out at 30 seconds. Now we're going to go to phase 2 of this treatment. And what I'm going to have you do, I'm going to take a couple pillows, and I'm going to place them right here. And you're going to feel them right in your back, right here. So you're going to go down slowly, take your time. Now you're going to keep your head at that 45 degree, yep, adjust it as you need, and you're going to bring your head back while maintaining that 45 degree, 30 degrees, and that's about 30 degrees right there. How are you doing, Bob?
Good.
Now this has to be done slow, and if you do it slow, you shouldn't have too many symptoms that are making you feel nauseous or real dizzy. If you do, it's too fast and too much too early. So then we're going to hold this for 30 seconds. Okay? And you're going to time it. A lot of times I like to use, I've got a clock on the wall in the clinic, and I just got a second hand and I look for 30 seconds, or either that or I have someone come in and help me in time if that's not available right in front of me. And then we're going to go slowly to the left, okay, so that we're 45 degrees to the left and maintaining that 30 degrees extension. How you doing, Bob?
Good.
And I always communicate with the patient, see if they're feeling dizzy and things are spinning, but they'll let you know. It's you'll know it if you're doing this to yourself. Hold that for the 30 seconds. Bob, we're done with this position, and now we're going to go to the next position. So what I'd like you to do is turn to your left side. Okay, bring your knees up. Good, perfect. Go over like that. Now while you do that, keep your head angled down towards the floor. Good, bring the shoulder up. Okay, head down. There we go. Are you comfortable in that position?
Yeah.
We're going to hold that for 30 seconds. Okay.
Don't jump ahead. We don't have to hold it. I mean,
Right.
just pretend it's been 30 seconds.
Okay, now we're at 30 seconds, Bob. We're going to go to the next position. Now what I want you to do is bring your knees forward so your feet and knees are up there, just like that. Now tuck your chin in towards your chest slightly and slowly go up.
Look down the floor.
Exactly. As you go up, look more towards the floor. Hold it steady, nothing too fast. Good. How are you feeling there?
Good.
Good, okay. We're
And
gonna
keep the chin tilted down.
Exactly. Keep that down. Now this is the easy part of the treatment, Bob. After this 30 seconds, keep your head still. After this 30 seconds, the hard part of the treatment is the next 48 hours what Bob's gonna have to do is keep his head in a vertical position for 48 hours. Now, what I'm gonna give him to help him out, this means that you cannot look down, you can't bend over to pick anything up, and you can't lay down to sleep in bed. That's what makes this difficult.
You want me to come up now? That's been 30 seconds.
Okay, yep, up nice and slow, everything's feeling good, you're not spinning or anything?
No, I'm good.
Okay. You get yourself a simple neck collar, Velcro, they cost about $10 at...
It's a nice soft collar.
Yep, nice soft one, at any pharmacy store. Okay, and we're gonna bring this around your neck. You don't have to use this, but if you wanna maintain that head vertical position for 48 hours, this is a constant reminder that you need to keep your head up. Now, I have some patients, and what they'll do is actually take a couple days off from work or do it on a weekend, because you're not gonna be able to do this at work for most jobs. Okay, you okay with that, Bob?
Yeah, very good.
Again, this doesn't have to be tight. When you're sitting in a chair or standing and you want to take it off, you're welcome to do that at any time. You can leave it off. But again, it works great to hold that 48 hours. Because if you do bend over or you look down, you throw it off and you get dizzy again, it's not a big deal, but you have to start the whole process all over again.
And I think we should mention, Brad, that you may need to do the process over again.
Yeah.
Some people have to do this, the canalith repositioning maneuver a number of times before it actually works.
Sure.
And the other thing is, there was some debate online whether or not you need to do this part of it, the 48 hours.
Right.
The Mayo Clinic advocates this method. We've used it, when I was working at the Mayo Clinic, we did it that way. So I think I feel pretty safe in saying that it needs to be done.
Right.
So.
And it's been my experience in the clinic that if you have to do it a second time, after the first time, say you throw something off, you will notice some gains, you know, maybe 25% improvement. That'd be a good indicator to repeat it. But if you do it right the first time, hold that head up for 48 hours, it's your best chance for success. And use the neck collar, that's it. It's not a real difficult treatment, but it is challenging.
One last thing, Brad, just want to tack this on at the end of the video here. If you are 40, 50 years old or older, you're going to want to subscribe to us, because we are going to be covering videos that are going to help you as you get older, as you age, you know, stay fit and healthy. We're going to cover subjects like this and other things, you know, on fitness. So
Right.
subscribe.
Because we both are kind of in that age
We're in that age group, and
We have a
we've been treating people of that age group forever.
Right.
So
Well, you forever, but I'm a little younger than that.
very good.